Good morning. This is Dr. Roman Schneider coming to you from the Ozark Chiropractic Clinic here. It's a beautiful fall day. We're finding some cool nights, starting to cool down, so I think fall may be finally coming around to stay, and I think everybody's looking forward to that. I want to continue on a little bit what we talked about last week with our stomach health. We talked about some of the hydrochloric acid enzymes, some of the things to look for, what's going on. And I want to continue on that because it's a big problem in our country, the amount of drugs. I think this is, this is number like one of the top 5 or 6 drugs that's prescribed in the country. And there's a classification of drugs. They're called either H2 blockers or called proton pump inhibitors. Now, you're going to say, okay, that makes a lot of sense to me. I know what you're talking about. Nah, I get you. What these are called, these are what you're going to know them as. Nexium, things like Prevacid, Maalox, Mylanta, Tums, Tagamet, Pepcid, Zantac. Those are proton pump inhibitors. Those are all the drugs that we see on TV and through the ads in the stores that are for acid indigestion. If you got a reflux, indigestion, here, take this. And like we said, what their job is to do is to block the body from producing the acid. So that's where you get the relief from the pain or the discomfort and sensation you have when you eat. But like we said last week, that doesn't do anything to help the problem because your stomach is the most acidic environment in your body, and it's that way for a reason, to begin the proper digestion of your food. Really, digestion begins as soon as the food hits your mouth. There's enzymes there that start the process, but a lot of it starts really into the stomach with the acid, breaking down the parts, and then separating things out so that the body can absorb the nutrients that it needs. It can be passed on to the intestines, then properly eliminated. And so when we're not digesting that food, what's happening is it's putrefying in there. And that's where the burning sensation comes from. So yeah, when you take the medication, it's helping to block that, but it's not helping to block the problem that's causing it. And so you just really go on and making the problem worse. Now, when you're on these drugs, as in all drugs, there's a lot of vitamins and supplements that are going to be depleted when you're taking these things. And some of the list I have is that things like calcium, B1, B12 are depleted. Vitamin D, folate, which is part of the B complex, zinc and iron. So these are all very important parts for zinc, especially for immune system. Folate, the B complex, all for neurological development, enzyme reactions, breaking down sugar. Vitamin D also is very important for immune function. Calcium, bone strength and things. Iron, helping our blood, preventing anemias, things, keeping our body functioning, transporting oxygen. So you can see that all drugs have side effects. All drugs deplete supplements and minerals, and that's where you need to be taking things. So if you're on these, first of all, I would work on getting off of it, and then you can talk to us and we can help you through that. But if you're going to be on those things, then there's certain medications that you're on that you need to be taking supplements to help because they're going to deplete it. High blood pressure is one, they all do, and things. And I'll go through this list more, but I just want to continue on with that. So really look at what you're taking and what you're thinking about. And don't think it's just, I can take this and it'll be fine. No, because it's blocking and it's causing a lot of other health problems down the road. So look into that. If you have questions, call me, 667-5053. If you want to put something on the Facebook page asking questions, that's fine too. The website, ask questions in there. You can get just touch through there at ozarkchiropractic.com. But really think about this because it's a serious problem in our country. We're not helping matters. Our health just gets worse in this country as the years go on. We spend the most money. We've got so much technology, but we do the poorest job overall of most of the industrialized countries in the world. So think about that. So I want to wish you guys a great day. Enjoy this beautiful fall weather. And until next time, we'll see you later. Thanks.